Good afternoon, classmates. This is our reporting drugs affecting blood coagulation. Let us learn about hemostasis, prevention of blood loss when vessels rupture. It is a process that stops bleeding at the site of injury while maintaining a normal flow of blood. It is the first stage of wound healing, involves in the blood changing from liquid to gel. Intact blood vessels are central to the moderate blood's tendency to form clots. The endothelial cells of the intact vessels prevent blood clotting with the heparin-like molecules and thrombodilin and prevent platelet aggregation with nitric oxide and prostacylin. As you can see, normal hemostasis has three major steps. Vasoconstriction. Vasoconstriction means delivers oxygen. The constriction of blood vessels which increase the blood pressure in the blood vessels. Temporary blockage of a break by platelets plug, and the last step is blood coagulation or the formation of fibrin clots. These processes seal the whole unit tissue are repaired. There are four phases of hemostasis: vascular phase, platelet phase, coagulation phase, fibrolytic phase. In the vascular phase, primary constriction occurs that serves to decrease blood flow, followed by the adherence of platelets to the rupture endothelium and each other. Platelet phase. In this phase, platelets that circulate in the blood stick to the damaged tissue and activate. Coagulation phase. Blood changes from a liquid to gel, forming a fibrin clot. Fibrolytic phase. This is the last phase in which existing the clot into the fibrin clot. These are some clotting factors, include fibrinogen, prothrombin, tissue factors, calcium, prothrombo, unassigned labial factors, stable factors, trismus factor, plasma thromboplastin accident, hemogen factor, fibrin stabilizing factor. Drugs affecting bloods are characterized by their effects and goals for use: to stop clotting for formation, to stop bleeding, to enhance blood and its products. Clot stopping. In this clot stopping, we have anticoagulants. Anticoagulants are used to inhibit clot formation by inactivate one or more clotting factors, as we discussed earlier. They are used clinically to inhibit clotting in catheters to prevent blood samples from clotting, to prevent blood transfusion and to treat emboli that may occur. Anticoagulants do not alter the size of an existing thrombus or clot. This is the clotting pathway. As we can see here, blood clotting mechanism activated by the in the presence of calcium ions. Prothrombin activator activates and it forms the prothrombin to thrombin in the presence of calcium ion. Thrombin to fibrinogen in the presence of calcium ions. Fibrinogen converts into fibrin in the presence of stabilizer factor. It finally forms the blood from clotting formation. Anticoagulant agents includes, first we can have acid citrate dextrose, ACD solution. It consists of sodium, 25 grams of sodium citrate, 8 grams of citric acid, and 24.5 grams of dextrose, and distilled water to make a total volume of 1000 ml. Given at level of 15 milliliters per 100 ml blood. The toxicity of citrate blood injection injected intravenously varies with rate of injections and total dose. The lethal dose of the sodium citrate for the dogs is estimated to be about 132 milligrams per kg after extensive hemorrhage. In the normal intact dog, the lethal dose is 286 milligrams per kilogram. And we have second agent, citrate phosphate dextrose adenine. It is one of the most anticoagulants used in humans and veterinary medicine also. It can maintain the high level of erythrocyte so that it can cause clotting more. It affects more for the clotting viability for up to 20 days in dogs. Here are the examples of anticoagulants include heparin, clopidogrel bisulfate, ethylidine dynamine, tetraacetic acid, coumarin derivatives, aspirin, blood transfusion anticoagulants. Heparin, it prevents the conversion of prothrombin to thrombin. It acts in the conversion of prothrombin to thrombin. It stops the conversion of prothrombin to thrombin. Mainly used in the process of testing blood and transfusion. Heparin is used to treat heart diseases, and such as thromboembolism, where a clot or thrombus is construction or an artery of an heart. Heparin does not break down clots, but it prevents them from getting bigger. It is also used to treat disseminated intravascular coagulation (DIC) and laminitis in horse. Heparin side effect includes bleeding and thrombocytopenia. That means decrease in blood coagulation cells. Heparin overdose is treated with protamine sulfate. This is the strong basic protamine combines with the strong acidic heparin to form a stable complex with no anticoagulant activity. Next one is coumarin derivatives. This type of anticoagulants binds vitamin K1, thereby inhibiting the formation of thrombin. Coumarin derivatives are used for the long-term treatment of thromboembolisms and include the trade names drugs. These are drugs used for the blood anticoagulating agents. Overdose of coumarin derivatives can be treated with vitamin K1. Side effects include bleeding and weakness. Aspirin. Aspirin has an antiplatelet activity. This one is antiplatelet activity because it inhibits the stickiness of the platelets through the inhibition of thromboxane. It is used to prevent thromboembolisms associated with the heart-worm disease in small animals and cardiomyopathies in cats. So it is used in small animals and cats. Side effect includes bleeding, gastrointestinal bleeding, and vomiting. Caution should be exercised with use of aspirin in cats. Blood transfusion and anticoagulants. Acid citrate dextrose (ACD) and citrate phosphate dextrose adenine (CPA) are chemicals found in preservation bags used to collect blood for preservation. Both work by calcium. Side effects include fever, vomitings, allergical reactions. As we see, when we transfer blood, we can see some symptoms like vomitings and allergical reaction to newly transfusion of blood.
Good afternoon po. Naririnig po ba ako? Yes po.
Naririnig.
So I will continue our report about drugs affecting blood coagulation. The second category for drug affecting blood is bleeding control, which is yung mga hemostatic drugs. Hemostatic drugs help promote the clotting of blood, meaning to keep blood within a damaged blood vessels. This category of drug can be divided into parenteral and topical. Next slide. In parenteral hemostatic drugs include the following, which is yung vitamin K1 tsaka protamine sulfate. Next slide. The first parenteral hemostatic drugs is vitamin K1 or phytonadione, it is a synthetic version of vitamin K1. Vitamin K1 is involved in the clotting cascade. If it is not available, formation of some clotting factors is hindered. This medication is often used in veterinary medicine after animal eat certain kind of mouse or rat poison or yung mga rodenticide poison. And also, it is used for treating bleeding disorder. The brand names formulation include Aquamepyton, Mepyton, and Conicon. Yung mga side effect niya is including yung mga anaphylactic reaction, which is yun yung mga severe allergic reaction. And another side effect is yung bleeding from the injection site. And also, it is used in cats, sa dog, horse, birds, and rabbits. Next slide. Next pa. And the second parenteral hemostatic drugs is protamine sulfate. It is a basic protein used to treat hairpin overdose and bracken fern poisoning in cattle. This drug, protamine sulfate, it is given by injection into a vein or intravenous, and it is marketed generically. Side effect includes yung low blood pressure or yung hypotension and slow heart rate or bradycardia. Next slide. The topical hemostatic drugs are used to control capillary bleeding. Yung capillary bleeding, yun yung mga less serious than other forms of bleeding or yun yung mga minor bleeding. The topical hemostatic drugs include the following, which is yung silver nitrate stick, hemostat powder, gel foam gelatin sponge, and thrombogen topical thrombin solution. Next slide. First is silver nitrate stick, which has astringent, an agent that constricts tissue. properties to stop capillary bleeding. Silver nitrate is a medication used for cauterization, it is a process of burning of the skin to stop bleeding or preventing a wound from becoming infected. It also used to remove granulation tissue like yung mga pink or lumpy tissue over a healing wound or yung mga warts sa skin. It is used in cats and dogs. Next slide. Hemostat powder or ferrous sulfate. It is used to control capillary bleeding from superficial cuts and wounds, and also after dehorning of cattle, horse, sheep, or goat, or yung mga animal na may mga horn. If there is a sign like irritation, redness, and swelling may be seen with this product, using hemostat powder should be discontinued. Gel form, next slide. Gel foam gelatin sponge which provide hemostasis following surgical procedures. This sponge, available in a variety of size and shape, is applied to the bleeding tissue to quickly stop the flow of blood. The gelatin material is gradually absorbed by the body without inducing excessive scar formation. Usually, ginagamit siya sa cats and dogs. Next slide. Thrombogen topical thrombin solution, which is it act directly to promote the conversion of fibrinogen to fibrin. Topical thrombin is derived from animal source and is available as a sterile powder, which is usually reconstituted with sterile distilled water or isonic saline before use. The speed with which the drug promotes clotting of blood is proportional to its concentration. Next slide. The next category is blood-enhancing drugs. Include drugs that affect red blood cells. Erythrocytes or red blood cells are made in the bone marrow in response to substance produced in the kidney called erythropoietin. Red blood cells carry oxygen to tissue, and the hemoglobin is made up of heme protein and an iron-containing compound. Adequate amount of iron and other vitamins and minerals are essential to the formation of RBCs. Next slide. The drugs that affect the production of quality of RBCs include the following. First is yung iron, erythropoietin, cyanobalamin, and folic acid. Next slide. First is iron. Iron compounds include iron dextran, ferrous sulfate, ferric hydroxide, and other. Iron compounds are used clinically in the treatment of baby pig anemia and as a nutritional supplement. It also used in dogs and cats. Iron comes in both oral and injectable forms. Example of brand name forms are iron dextran complex injection, armedexan, ferrextran, pigdex, and imposil, iron grand 100, and purina of oral Pimegia. Yung mga side effects include yung discoloration at the injection site and muscle weakness. Next slide. Erythropoietin. It is a protein made by the kidney that stimulate the differentiation of bone marrow stem cells to form RBCs. It is used to treat anemia in animals with chronic renal failure. It is marketed as a human recombinant genetically engineered hemopoietin or epoetin alpha under the trade names Epogen and Proctin. Next slide. While human recombinant erythropoietin works in a dog and cat, it is not the same protein, and antibodies eventually develop in response to its exposure. Because of this, allergic reactions are sometimes seen with erythropoietin products. At the present time, the amino acid sequence of the canine and feline versions of erythropoietin are known, but commercial products are not available. Erythropoietin must be refrigerated. Next slide. And next is cyanobalamin. It is a vitamin B12, and it is used to treat vitamin B12 deficiencies and certain types of anemia in many species. It may also be used in animals with cobalt deficiencies and certain pancreatic disease or intestinal malabsorption problems. Cyanobalamin is a cobalt-containing water-soluble vitamins that serve as an important cofactor for many enzymatic reactions in mammals that are required for normal cells growth and erythropoiesis. Next. Yung cyanobalamin, ginagamit siya sa cats and dogs. The brand name include Kynoject and Rubesol and are available in injectable and oral forms. However, oral forms are not appropriate for small animals and medicine due to limited gastrointestinal absorption. Next slide. And the last is folic acid. Folic acid is a vitamin needed for normal erythropoiesis, and deficiency of folic acid may be seen in dog, cats, and horse due to small intestinal disease. Some brands of folic acid are folate and folacin. Yung mga few side effects from folic acid is yung administration with either the oral or injectable forms kasi nagkakaroon ng hypersensitivity reaction or yung allergic reaction or gastrointestinal upset. Yun lang po yung report namin. Thank you po.
Okay, do you have questions about the blood? Drugs affecting the blood. May nilagay ba kayong hematenics? Wala yata, no? Maybe you can add. Hello. Are you still there? I think you have not included the hematenics. So, hemostatics lang yata yun. Yes, Shami?
Yes, doc, because we didn't have proper reference for this drug coagulation, doc.
You're choppy. I can't hear you clearly.
Doc, can you hear me?
Yes.
Actually, we don't have proper reference for this drug.
Okay, so I have uploaded the. Actually, I have uploaded
Yes, doc.
the reference. Maybe you can add some of the drugs under the hematenics. So we have the hemostatics. This stops the bleeding. Okay, and how about for prevention of anemia? So we have hematenics.
Okay, doc.
And also you can add also the blood therapy. Okay. About blood transfusion, maybe you can add that so that your classmates have the idea on how to do the blood transfusion in animals. Yes, Nicole? Sa inyo ba yung blood therapy? Ay, oo, oo. Okay, it is separate. Sorry, sorry. Thank you for the correction. So it is a separate the blood therapy. So only hematenics and hemostatics.
Okay, doc.
Okay, do you have questions in the report? Any questions? Or do you want to share something else about the hemostatics? So which is very useful, especially during the surgery and also some traumatic injuries. So we always use hemostatics. Okay, this one is for prevention of blood loss. And also for treatment of poisoning, okay, especially the use of rodenticides or warfarin. So warfarin is also a drug, no? So which is given for the animals for prevention of thrombosis or thrombi formations. But it is given in appropriate dose because it is under poisons, the warfarin. But it is also a drug. Do you have questions? Who's the what group is the next reporters? So yun yung hindi sila ready kasi wala si Tio Mel. Anong report nila? Kasi wala yung listahan ko dito. Sige, book sa ano na lang. So, nag-check ako ng papers ninyo. And, nahirapan yata kayo sa exam. Hello? O nanibago lang kayo dahil face-to-face na? So, I've been checking. So, actually, your midterm exam has been checked. Part 1 and test 1 and test 2. And I'm currently checking on the test 3. And I found out that the test 3 is quite difficult for you to answer. Especially, so nahirapan kayo sa essay yan. Eh, pamigay na yung essay.
Dok, nahirapan po kasi kami sa di po namin expect.
So you should expect the unexpected na lang kasi. So of course, preferably, so more of ano tayo, multiple choice type of questions. And syempre may mga a little bit of identification or a little bit of discussion. Magre-report ka na rin, di ba? Oo, maybe 3. 3 reports. Oo, face-to-face. You have question? Shami and Jeline and 3 ba kayo? O 2 lang?
Dalawa lang po, Dok.
You can add the supplemental notes under hematenics. Paki-present na lang by Wednesday.
Okay, doc.
I have already uploaded the reference. So please find it in the what's that? Applied Pharmacology for vet technicians. So I have seen the chapter there for blood therapy, for blood coagulation and hematenics. Okay, so we will see you on Wednesday face to face. So to continue our report, and of course, I will be giving back your papers on Wednesday. You have questions? So for the yung tanong mo, Nicole, no? So you are asking about when will be the laboratory exam. So maybe we will be scheduling it next week. So is it okay for you to schedule it on next week by Wednesday next week? Hello.
Huh?
Okay, I guess we will talk na lang sa Wednesday na lang. Balik-baliktad ako. Send ko kayo. Hello. Pag-usapan na lang natin by Wednesday.
Yes, Doc.
Medyo ano
po,
kasi,
Doc.
mahina yung net ngayon. Okay lang. Okay, kung wala nang tanong, yun lang muna ngayon. Kasi liligpit na rin kami before fumigation.